100,000 times a day, an electrical pulse travels like a wave between two clusters of nerve cells in your heart, dictating their rhythmic contractions electrically. It's what makes your heart beat.
The heart does much more than just pump blood. There's an electrical system of the heart, which allows the heart to keep its cadence, so to speak, its internal metronome, something that's been pounding in your chest since your 8 weeks of life in your mother's womb.
When the heart is weakened, its electrical system is prone to developing abnormal impulses that can lead to sudden cardiac arrest. Those abnormal impulses are called heart arrhythmias.
The heart only causes death from failure in a relatively small percentage of folks. More frequently, it's sudden death from a heart attack or sudden death from an arrhythmia, which means an irregular heartbeat that suddenly causes the heart to stop beating. So half the deaths are because the electrical system malfunctions.
This is why a common emergency treatment for a heart attack is using an AED, or automated external defibrillator, to shock the heart back into its normal rhythm.
Shock delivered.
Heart arrhythmias are defined by where they occur and also by how they affect the speed of your heart rate. A normal heart rate is between 60 and 100 beats per minute. Tachycardia is when you have a fast heartbeat, greater than 100 beats per minute. Bradycardia is when the heartbeat is slow, or less than 60 beats per minute at rest. Both conditions can go unnoticed, but can share similar symptoms like dizziness, shortness of breath, fainting, chest pains, and heart palpitations.
There is a rhythm called atrial fibrillation, which is particularly prone to generating clots on the wall of this pump, one of the chambers of the pump, and then dislodging them. And as they travel through the system, they have a good chance of coming up the carotids and blocking a critical artery in the brain. And if that stays blocked, we're paralyzed for life.
People with bradycardia, with the exception of highly trained athletes who have a very low resting heart rate, often have a malfunction in their heart's pacemaker cells. The most common treatment for this is an implantable pacemaker, which generates electrical impulses to regulate your heartbeat. Common causes and risk factors for heart arrhythmias are previous heart disease or heart damage, high blood pressure, diabetes, smoking, excessive use of alcohol or drugs, including caffeine, sleep apnea, and stress. Doctors can diagnose and test for heart arrhythmias using passive heart monitoring devices like electrocardiograms or echocardiograms. Or they may try to induce an arrhythmia through a stress test or other active heart monitoring test. The best way to avoid heart arrhythmias, like all cardiovascular disease, is by maintaining a healthy diet, exercising, managing high blood pressure and high cholesterol, and avoiding risk factors. Depending on the severity of the condition, doctors can treat heart arrhythmias with medications, implantable devices, and surgery if necessary.